Well, look, this is a good news story with a difference, especially in the current climate. And remember, if you've got a good news story, email us, goodnews@skynews.com.au. We've had a bit of fun today, by the way, because we had a couple of good news stories, but you won't believe it. I mean, telecommunications being what it is, then, because many of these come from the bush, then bang, down the lines went. But here we are, because my attention's been drawn to a medium-sized charity called Hands on Health Australia. And it works with people living in disadvantage. And this relatively unknown charity actually looks after 80,000 disadvantaged people in the community every year through clinics in Queensland, New South Wales and Victoria. It provides physical and mental health services, as well as wellbeing programs and financial and legal counsel. And for the first time in its 35-year history, it's reaching out to us for some financial assistance, simply to assist a worthy charity who want to assist others. I might add the national patron is Yvonne Goolagong, and the international patron is Patch Adams, the American physician, comedian, social activist and author, but he's also a clown. And each year, Patch Adams, who's 75, travels to various countries where he and the volunteers dress as clowns to bring humour to orphans and patients and other people. Dr Sam Ginsberg is a psychologist and also a patron of Hands on Health. He joins us from his home in Melbourne. Dr Ginsberg, thank you for your time. Can I just say on behalf of many what wonderful work you do? How do you do it?
We do it by a total commitment to the aims and objectives of the organisation. As you said in your preface to the interview, we see 80,000 people a year, and virtually all these people are disadvantaged in the community. The disadvantage ranges from their income. They may be homeless. They may have chronic mental health problems. For many of them, they're lonely and they need care and support, and they come to us. Many of our clinics are drop-in centres where we can build trust and a relationship, and through this get an idea of what services these people may need and what in fact their requirements are to lead a happier and healthier life.
Yeah, can I just ask you, in the response to this virus, I mean, that presumably must have added hundreds of thousands of people to this category of disadvantaged. What new demands have you had to meet?
The new demands are people with existing problems who are placed under stress find that they reach a breaking point.
Yeah.
This may be in relation to high anxiety. When will this end? Will it affect me? Perhaps it's affected their family. It's obviously may have affected their housing. Many are paying rent and struggle to pay rent. There's a myriad of problems that are existing. Are increased by this coronavirus.
It's hard to believe it's Australia, isn't it? You've launched a public campaign asking for financial support, and I understand the donations can be made at HOHA. It's on your screen there, hoha.org.au. How many people are working for you? Are they paid? Are they volunteers?
They're all volunteers.
Goodness me.
We have 400 volunteers, and the clinics are funded by private enterprise and also by raising funds in the community. So with the decrease in running funding programs, our funding's decreased hugely. And given the government's 15% revenue and also the criteria for services, we don't fall under that banner, mainly because the services we provide are dependent on the volunteers who come from the community. So one clinic may have a dentist,
Yes.
But the clinics who haven't got a dentist in the community who's prepared to volunteer will not have that.
Sorry, Doctor, just tell me this. I mean, people are in a state of very significant anxiety and distress and have a great need, but Australians are very proud people and they don't like asking. How do people who are feeling disadvantaged and feeling they've got nowhere to turn, how do they make contact with you, with your charity?
Yes, we're very well known in the community. because we have a walk-in, drop-in centre, it's far more informal. So people feel comfortable coming in, and also they build a relationship. It's all based on trust. And when you're deeply embedded in the community, you develop that relationship with the community.
Gee, well done. Look, congratulations. It's amazing stuff. I just find this very, very distressing. I mean, every day there are people. I don't think our leaders understand this, the way they're behaving and the anxiety they've created and the ruthlessness with which they just issue and bark out these orders to people. You can't go here, you can't leave your house, you can't move there, that shop's got to close, this business has got to close, you're out of work, these kids can't play sport. Do these people live in the real world and understand the level of anxiety out there?
Well, I think they do, and they try to. But the point is that there's a distance between those who make policy and talk about these things and the people in real life out in the community. If Hands-On Health has small clinics, very close, so we hear the personal stories, and that's what makes the connection. It's a model of bureaucracy where it's a distancing from people, and you need some sort of structure to make policy and make decisions.
Absolutely.
But the further you are from people, the less you understand the problem.
Absolutely.
If you have seen a family coming in distressed because the father's lost his work, they haven't got money to pay for food and rent, and they're terrified that they're going to get COVID infection.
All right. Well, look, we'll see if we can help get some money for you. That website there is hoha.org.au, and I think, Doctor, thank you for your time, but I think the most important point you made there is the gap between these people barking instructions and Anastasia Palaszczuk, Gladys Berejiklian and Daniel Andrews and Scott Morrison. If you actually got to the coalface and saw the devastation and the emotional and psychological damage you're causing, you might think differently about the way in which you're responding to this virus. Doctor, I'm grateful for your time.
Yes, can I just add, we would love all those people you mentioned to come to a clinic.
Yes.
And just for 1 hour to meet these people.
They don't worry.
They understand the problem.
Yeah, don't worry, Doc. They won't, I can tell you. Thank you for your time.
Really
that website, not at all. hoha.org.au.